Are the traditional forms of screening cancer with mammograms, ultrasounds, MRIs, biopsies always the safest and most effective ways to find disease in your body? Is there potentially another way that can be used, something else that can be used that is less invasive and will be able to um, tell you what's going on in your body, and it's cost effective and it doesn't have the risk that the traditional ways of screening your body may have? Well, there is. And how exciting I am to that Dr. Joel Fuhrman, who normally comes to talk about nutritional excellence, and I'm sure we'll get into a little bit of that. But today we're going to be talking about the passion that he has in his heart to help people reverse and prevent cancer naturally. As you know, Dr. Fuhrman will be zoomed in to the I Am the Solution Natural Health Summit for cancer and autoimmune disease. And we're going to be learning a lot from him then on November 1st, so mark your calendars. But today we're going to be talking about how to use these, look at these conventional therapies or treatments or ways to discover whether or not your body has cancer or and test and monitor it in a less invasive way. And I'm so grateful that Dr. Joel Fuhrman, he is a New York Times bestselling author. He's been a teacher in the classroom since 2015 and such a welcome guest every time he comes on. So get your pencils and paper because you're going to be needing to take lots of notes. I already have, and we just started our conversation a little while ago before we hit the record button. And so I've already started taking notes, and I know you will too. So let's take some notes together so we can learn and grow together. And when you need a friend, you can count on me. I'll be right here waiting for you. Hi, my name is Lily McDermott. I'm a certified life coach, a certified holistic cancer coach, and the host of the Lillian McDermott radio show Classroom. If this is your first time in the classroom, please know I've been waiting for you. This is a safe place where you can go when you need a friend. It is my commitment to provide natural ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening, as well as my viewing friend, will feel empowered to embrace a new truth and live the life of your dreams. As they say, when we know better, we do better. But if we don't know better, then we trust in people that are trying to sell us something that conventionally has been used for years and years and years, but do not tell us what the side effects are or what they could be. So today with Dr. Fuhrman, I'm grateful that he's here in the classroom to give and receive love and knowledge, because that is our number one goal in life, to give and receive love and knowledge. And I'm grateful that Dr. Joel Fuhrman is here to do just that. Welcome back, Dr. Fuhrman, to the classroom.
Hi, great to be here.
Well, you have a lot, even the conversation that we had before we started the record button, I was like, no, we need to stop right now because we need to record this conversation. So share a little bit about why you want to have this conversation today, when it comes to the screening and the conventional ways that we screen for cancer.
Right. And I've been speaking about this for decades. And I just got done with a cancer summit that I was the host of. I ran.
Mhm.
I interviewed 20 other experts in the nutritional treatment of cancer or holistic cancer treatments. And I discussed in the summit that mammograms cause net harm. That in other words, they hurt as more people than they help. And we're going to discuss that right now and why that's the case. And but um, in this exposure and speaking to people and looking into this further, I was made aware of this new technologies that have emerged in the last few years. And these new technologies have emerged. One is called QT imaging. It's a new testing for breast cancer that uses circumferential sound, and it doesn't expose women to radiation. And so we can talk about that a little bit too. So we have all these. There are new screening methods, new treatment methods that are more effective, don't expose women to radiation or toxic drugs, and they're um, they're not in the same ballpark as what are available to women already because we're causing too much harm and too much suffering and too much death. So we got to break this down step by step and discuss this. And in conjunction with this, it's a little self-serving because in my having the exposure to these new treatments and new modalities around the world right now, and my daughter, who's now a doctor and just finished naturopath school, we're opening up a new office in San Diego here. And with some of these new technologies, including the QT imaging machine we're talking about, and the echo light and the lymph machine and the mortal chamber, we have a lot of these new technologies that can reverse osteoporosis, prevent breast cancer, and plus the blood test availability that can detect every cancer in the blood, so you can tell if a person has an early stage cancer way before they can ever have a mass that can be seen on a test. And then we can intercede with nutritional therapies that wipe out cancer before it becomes to something that has to be treated conventionally with chemotherapy or radiation. So we're using both nutritional therapies, diet, peptides. We have all these things that can attack early stage cancer. So it never even gets to cancer. So
Yeah.
that's what we're talking about. And we set up an office to be able to do this and utilize these new technologies.
Yeah.
So we will talk about mammograms and ultrasounds and MRIs first, and even thermograms first, and show why
Yeah.
those things do not work and are not worthless. They are worse than worthless. They cause net harm. So let's discuss that
Yeah,
first.
let's try that. Let's do that.
Yeah. Number one, mammograms expose the breast to radiation. And getting them year after year increases the risk of having a breast cancer. They're not good they're not only not good at viewing dense breasts, which is like 30% of women. They can't really see behind implants well, but dense breasts also, not only aren't they good at visualizing masses in dense breasts, but the dense breast soaks up radiation and is more potential to be damaged from radiation. So let's continue on this thing with mammograms. You get an abnormal mammogram that looks suspicious. It doesn't give you a firm diagnosis of cancer, yes or no. You don't know if you have cancer or not. You just have something that looks suspicious on a mammogram. Then they send you for a biopsy. That's where the problems start. It's needing a biopsy because the pathologist has no ability to tell under a biopsy if you have cancer or not. So because the cell doesn't look, it's not a black and white thing.
No.
He has to make a judgment call. And does the cell look a little abnormal, a lot abnormal, super abnormal, or just a hair? They can't really tell. So what happens is that because they don't want to miss half the cancers, they overdiagnose.
Hmm.
It's estimated that about 40% of women who told they have breast cancer
Yes.
never have a problem, a cancer that would eventually cause their death or interfere with their life because the doctor diagnosed them with cancer, but the rate of replication is not in the cancerous range, but the pathologist can't read that. They can't tell. So to play it safe, they diagnose all these women with cancer, and the common cancers they diagnose women with that we don't know if it's true that they have cancer or not are invasive lobular carcinoma and invasive ductal carcinoma.
Hmm.
80% of cancers are invasive ductal carcinoma and invasive lobular carcinoma, let alone ductal carcinoma in situ. It shouldn't even be called cancer. That's not going to kill a person. But after the ductal carcinoma in situ, we have invasive lobular and invasive ductal carcinoma, which the pathologist can't tell for sure if it's cancer or not. So it just gives you a diagnosis of cancer. Then the person, because they have a diagnosis of cancer from the pathologist and they believe the pathologist is right, they go on and get chemotherapy and radiation, which then increases risk of death and causes heart attack deaths and cancer deaths and other cancers from the chemo. So what we're saying here is that you have needless harm, women being treated needlessly for cancers that they don't have. And then, yeah, there are some women who have the cancers who are helped somewhat, but keep in mind, postmenopausal estrogen-positive breast cancers are slow-growing cancer, and they don't grow linear in a linear fashion. They don't just continually grow. Some of them go back the other direction and get better. And we can make them get better instead of growing with the right type of nutritional and natural treatments anyway. But in any case, there are some like premenopausal cancers that are aggressive, like HER2 negative cancers and premenopausal cancers that chemo is absolutely essential, necessary for prolonging survival. But the people that are saved from that is a very small percent compared to the 30 to 40% that are harmed now and given chemotherapy needlessly because they never needed it. So we're saying the net harm comes from the number of women that are hurt versus the number of women that are helped. And for example, in the Cochrane analysis, the Norwegian research teams that analyze these information, they've determined that more people are harmed than hurt. And furthermore, there was a large study in Norway where they had half the population got mammograms and half the population didn't get mammograms. There was no difference in death rate at all or longevity at all, except for the group getting mammograms had many more women winding up with a cancer diagnosis. So you have more people walking around with the fear and terror in their lives and thinking they have cancer when they didn't have to have that. Know that. Okay.
And
Then
that is a form of manipulation. That is a form of manipulation because we've been indoctrinated that what you do with cancer, if once you have cancer, if you get cancer, you're going to die. So you're going to have to do chemo, radiation, surgery, and,
right.
and and they do it in such a quick form, such a quick process that it doesn't give you time to even think.
It's big business, right?
It is,
There's
it's
billions of dollars invested in these technologies,
too
and
big to
then
fail. Yes,
right.
too big to
All
fail.
right, and then so the mammograms expose you to radiation, or you get an MRI. But they put high-risk patients and patients with dense breasts or implants under MRIs and give them, gadolinium. They give them a toxic radioactive metal,
Hmm.
which is also, going to cause problems. But the same problem with an MRI is worse than the mammogram. It's worse because you have more overdiagnosis. It finds things that didn't need to be found, and more abnormalities found on the mammograms and more abnormalities found on the ultrasounds lead to more needless biopsies and more women diagnosed with cancer that don't have cancer. Sure that. So we're saying here that even though ultrasounds don't expose you to radiation, and even though mammograms aren't direct radiation, they give you a dye that's a toxic metal. So in any case, you're still putting poison in your body to get those tests. And the same thing is true with a thermogram. The thermogram is heat seeking, looking for clusters of heat because cancer cells because they promote angiogenesis and glean a heavier blood supply. A mask that gets a heavier blood supply can be recognized on a thermogram, but it's not a definitive diagnosis. The diagnosis is made on a biopsy. So the same thing is wrong with a thermogram that's wrong with an ultrasound. You're not using radiation, but you're still diagnosing. You still don't know if the person has cancer or not when you see an abnormality there. You need a biopsy to diagnose it.
Yeah.
Okay, so the bottom line is that my message has been that if women never got tested and they just ate healthfully, we'd save millions of lives, millions and millions of lives, and people wouldn't be so worried. Some people, but in any case, that's my chief message is don't keep radiating the breast and don't go for biopsies because even taking chemo for postmenopausal breast cancer, in other words, we're saying that the the rare premenopausal aggressive breast cancers compared to the more common, slower growing postmenopausal breast cancers, chemo is not effective for postmenopausal breast cancers. What do they extends life like 3 or 4 months? You might as well, you don't even, so eat right and get well and don't get. Okay, then that was my initial message, but then this machine comes along, QT imaging machine comes along. This is what this machine does. It's a new technology. I mentioned to you earlier, it's
Yeah.
super expensive. You can buy like 10 Rolls Royces, whatever for the price of this machine. I don't know. But in any case, um, it has sound waves. Suspends the breast in body temperature water. There's no compression. And then it has a circumferential sound waves of 1,000 of looking at the breast at all angles. So it can reconstruct the breast, whether you have an implant or dense breasts, to
Wow.
see any abnormalities in the breast. And there's more than 200,000 more identity points than a mammogram or an MRI. 200,000 more accurate points to measure the accuracy of whatever abnormality you're looking at in the breast, even a benign mass or a cyst. So because it's so accurate at ascertaining, is that a cyst, is that benign, does it look more suspicious? It's 3D imaging this, where you could see the shape, the contour, and the consistency so accurate. And because there's no harm and no radiation, no chemicals, if you think something looks suspicious, you can diagnose it without a biopsy. You can just have a person repeat the test in 6 weeks and see if the mass was growing, and you can track the rate at which it grows. So we know the rate at which cancer cells grow, we can accurately diagnose cancer before you need a biopsy, thus freeing up 40% of women from ever having
Yeah,
a diagnosis of cancer.
that's
Because
amazing.
that'll knock out 40% of the people won't have to be treated to go on to the next step, number one.
Yes.
Then if you had a cancer, we can monitor the progression of our therapies and even our natural therapies, whether we're giving women, the Halen or, EGCG or whatever therapies we're giving them, the diet plus all these mushrooms and the curcumin extracts and whatever therapies we're giving, we can now monitor the cancer mass so accurately with the AI volumetric reading of this thing. We could see if it's starting to shrink or react. We can see what we're doing with the natural therapies very accurately. And so the person in most cases wouldn't even think of doing chemo because the natural therapies not only are working, we can see them working, we can prove them working, and the women gets reassurance. Plus, we have these new blood biopsies that are available. That's less expensive than the Grail, the Galleri test you send to Italy for $1,000 a shot. They're about half that price, and it tests for every cancer in the body.
What test is that, Dr. Furman?
It's a test. It's not called CancerSeek. It's much better than that. It's made by Precision Eugenics. I'm forgetting the name of the test right now. Um, but so we have this test that's available that we can pretty much tell a person doesn't have any cancer in their body with
Oh,
this new testing, right?
okay.
Blood testing. And if the test comes back negative, then you don't have cancer. It's like 99.5% certain that a negative is true negative.
And this
But
particular test, is it done in the United States or is it flown over
no,
to
that's what I'm
Europe?
saying. We have now a
Gotcha.
better test in the United States. The
Good.
one we send to Europe that costs twice as much money
Yes,
doesn't
yes.
test for brain cancer and is not as accurate at picking up all the cancers as this new test that's done here in Arizona. So we have a test, this new technology that's done in the United States that's better than the Galleri or the Grail test sent to Europe. We have a better one now in the United States now.
Text me the name. I want to do some more
Yeah, I'm
research on it. I
sorry,
think it's
I
wonderful.
didn't write
No,
them. Yeah,
no,
because we're
that's
just
okay.
opening up the clinic and we have all these new things we're getting, so I forgot the
No, this
company
is
we're working with.
wonderful. This is
Yeah.
wonderful. Keep talking. This is really important.
Yeah, it's really fantastic that we can actually now let's say a person has a positive test. 1.5% of Americans getting this test will be positive for cancer. You know, this is not doesn't this is the you have the CT imaging, the QT imaging machine, right? Which puts all mammograms, MRIs, and out of business. But
And it doesn't have the same radiation that a mammogram has or a CT, like you said earlier, a CT that doesn't have that.
no, a CT scan or an MRI exposes you to a CT scan is a lot heavy radiation.
Yes, yes.
Mammogram, which you don't really image the breasts for that, but it's really not good to ever get a CT scan for anything.
Yeah.
Right, the QT machine works completely on sound waves.
Sound
You know,
waves.
sound waves. It's completely harmless. You can do it,
I
and
love it.
plus we have the Echolight machine that's like a DEXA scan. It's a REMS DEXA that tests for bone mass, bone fragility, body composition, visceral fat
It's
without
great.
radiation. That's more accurate than the radiation DEXA
Yeah.
scan. And now that's indicated because there's no radiation, it's all done with sound and it's more accurate. We can use it on children. And the advantage to using it on children, I mean, you have a daughter doing ballet, we can see whether she's going to develop shin splints or whether her bone mass is adequate enough or her feet look okay if she's going to get hurt. Or if your son running cross country, or playing basketball, we could say if there's risk for Achilles tendon rupture, we can analyze the density and the fragility of her bones, his bones and tendons without using any radiation, just on sound. So the technology that we're importing, this is Italian, we imported from Italy, these machines, but it's incredible. And they're using, and the once you identify a problem, low bone mass or an injury, then the lymph machine can heal, can help the fractures heal, and can reverse osteoporosis relatively quickly. So we have the ability without, and we know that the same thing here is with conventional therapy, taking medications for osteoporosis causes atrial fibrillation and heart attacks. A recent study came out last month showed 40% increased risk of heart attacks in women putting
Wow.
on these medications for their bone mass.
Wow.
And I just had a woman last month come in with a mid femur fracture from taking the drugs for 10 years, caused her bone to break right in half, and it causes jaw damage.
Yeah.
Talking about these drugs should never be on the market,
Yeah.
but now not only do we have exercise and supplements, but we also have this new technology which changes ion channel flux, which helps rebuild the bone. And we can see and we can document the rebuilding of the bone on the test that uses no radiation. So you don't have to wait 2 years to get another test. We can test in a few months and see if the bone's building back again. So we have the equipment to document the efficacy of the treatments. So we could use natural, harmless treatments and prove they're working so people wouldn't need to do something dangerous. But getting back to this idea of ultrasounds and QT imaging, the we have the ability to, with a combination of blood work, testing tears, and putting on QT imaging, we could tell a person she absolutely has zero risk of cancer, never needing a biopsy. And we can even take women who've been told they have cancer, told they have cancers with breast abnormalities, who are considering a biopsy or have a biopsy. We can still put them back through these tests and determine whether they have cancer better than the biopsy could have. And we could set their mind at ease, or we could tell them, yes, it's an aggressive cancer that needs to be treated. We can give them more, we have the technology in order to give them more definite advice on what's wrong with them, what should be done, and whether it's something to worry about or not. Because you're left in this, you're thrown into this big vat of not knowing what to do with conventional therapy. It's, as you said, it's all like a money-making game.
Yeah. Yeah. Now, I know that along with this conventional medicine, there is insurance. And insurance is a huge manipulator as well as to where you can go and have you need to have whether it's they won't pay for certain things like that, like thermography, like we talked about, that's like the less invasive one of the ones in the past. Now that you're talking about QT imaging, has insurance made a move to say, okay, we really value this and we want to encourage women to go this route, or no?
Maybe in 10 years, I'm estimating 10 years, because right now, QT imaging is the newest and greatest technology. It's going to put all these hospitals out of business, have already invested billions of dollars in equipment in a billion-dollar industry here based on mammograms and MRIs. And they're not going to buy a 600 or $700,000 machine and throw all their older equipment out, so we know it's not going to, there's only six in the United States right now, you
Hmm.
know, so it's going to take maybe a decade for it to be in more general use.
Yeah.
That's the way technology works. It takes 10 years or more to infiltrate to be, even though it's FDA approved and even though it's, the technology is proven and even though they're using it all in Europe, and even though all the sports teams in Europe, so they heal fractures with a lymph machine, you can build backbone, but still into this country, it takes a lot longer. So there's that, so it requires a person to pay cash. That's true.
And what is a cash payment for a test? Because it sounds like it's something that's viable. It's something that would be very beneficial for everybody, and they need to stop thinking about what will the insurance pay and start focusing on what is best for my body.
Correct. That's correct. The test is about $600 for the QT imaging test.
Okay.
But we're also doing lectures, events where we're asking for people to donate at these coming to the event, and the donations go, we don't take any money. The donations go into, we got this, a special fund, a nonprofit, which then is able to
Oh,
pay people's testing that can't afford it.
that's
You know,
amazing. That's
we're trying
great.
to fundraise for people who can't afford it. And then also, if people get a positive, the UC test, which is a test for cancer, if they get a positive cancer test and they need some extra imaging now, so to search where the cancer might be. It says you have colon cancer. Now I got to get colonoscopies, or maybe I could have, like, what's wrong with me? I might
Yeah.
need CT, memorize the brain.
Yep.
Then $2,000 is set aside for each patient, so
Wow.
that so the people with the positive tests will be given $2,000 to be able to look for the cancer and find it.
That's
So we have
awesome.
money set aside to help people, assist people in that way. But of course,
Yeah.
most people are going to have to pay cash for this equipment. But of course, your life's on the line, and you're going to pay more conventionally anyway because
You are.
you're going to be putting more, because one therapy leads to another, to another, to another, and we're setting the person, giving them the confidence there's nothing wrong with them
Yeah.
in 99% of the cases, because it's the overdiagnosis. Think of all the because in Europe, they estimate, this is studies that are done, they estimate that 30% of women in Europe are overdiagnosis, but in the United States, it's more like 40% are overdiagnosed.
Mm.
That
That's
means falsely diagnosed with cancer, getting treatments for cancers that they never needed, you know.
And eventually they get cancer because of the treatment they received causes cancer. That's the side effect.
That's the
And
side effect
yeah.
is a later life cancer. And all these women walking around thinking they're cured, that they were saved from the mammogram finding their cancer, and now the doctors saved them. And in reality, they weren't saved. They were just treated needlessly.
Mhm. Amazing. Now, and then one thing is that they want to do is they want to penetrate the tumor to biopsy it. Now, I love the fact that with the QT imaging, there's no need to biopsy at first. I don't know if eventually there's a need for biopsy. I know that many doctors that I've spoken to that have heard that there is no need. I've heard many doctors say there is no need for a biopsy, especially for the prostate or the breast because it's such a small area, and that when you pull and when you retract the needle, there are cancer cells that will spread in the body. But then I have other doctors say, "Oh, that's just nonsense. That the benefits outweigh the risks." What would you say about that?
That the whole purpose here is that we can act, and I'm saying, that people can fly in from anywhere and stay a day or two in Southern California and we could test them. But in any case, we can accurately test them better than a biopsy to tell them whether they have cancer or not. So the biopsy is not accurate. We can accurately tell them that this is not a cancer that needs a biopsy. Or if it is a severe cancer, then they can proceed to more aggressive treatments. But we're saying that at least about 40% of women would be freed having the need to have it biopsied.
Yeah, worth the money and the trip for sure.
And
Okay,
also, I'm saying something else that's kind of interesting that yes, premenopausal breast cancers that occur in people's 30s, 40s, and 50s, which are going up like crazy, right? More women, those are more dangerous. And if you find a mass that looks cancerous, it's growing, then you need a biopsy because the probability of needing chemo is very high. But if you are over the age of 60 and you have a postmenopausal breast cancer that's relatively slow growing, but still in the cancerous range, we don't have to biopsy. We can treat it and prove that we're slowing its growth or it's going down. And we can only, so there's even those don't necessarily have to all be biopsied and treated because most of the postmenopausal breast cancers are better off not getting chemo. You're better off just using nutritional therapies on them. And if you're using nutritional therapies, it's not knowing the exact nature of that cancer is not as important if we're seeing it's improving or getting better with our treatments. And because we're following it with blood and with tests that require no radiation, there's no harm in repeating the test 2 months later or 3 months later to make sure what we're doing is working.
I
So
totally
yes, we
agree.
can.
Yeah.
It's just a more um, higher technology, more effective, less invasive, safer, and more accurate. It's much
And,
more accurate.
like you
Yeah.
said, because it's newer, it's more costly. I envision, like you said, in 10 years, maybe insurance will pay for it, so that people don't have to, choose to go against their insurance. Let's say that.
Right.
But to be able to choose your own and say, okay, I'm gonna do this because I know it's not invasive and it'll tell me more than a mammogram or a biopsy at the moment or a thermogram will tell you. Because with a thermogram, I've had thermograms before and it's really hard to read. You really don't know what you're looking at. And then you get the reports from the thermographer, the person that's reading the thermography, and it's so vague that you go, okay, I'm damned if I do it, I'm damned if I don't. So it sounds like
No,
with the
it's no
QT
better than
imaging,
yeah, it's no better than an ultrasound.
yeah,
It's not radiation, which makes an ultrasound tomography good. It's not going to damage the woman's breast. What makes it bad is it doesn't give you a definitive answer. And the women who have it just leads to people having finding things that are suspicious.
yeah,
And the things that are suspicious have to be biopsied.
hmm,
So that's the present, is leading women into biopsies. But in any case,
that's amazing.
here's the thing and how it could save people money. Just imagine that you're a woman and what if you, and it takes what, 20, 30 years for a cancer cell that becomes abnormal to manifest in a mass that could be first seen by the human eye on a mammogram?
Hmm.
So what if we did a QT imaging on your machine and your breasts were clean? which means there's no masses that have been there. The cancer's been there. And then we do a blood test to show there's no cancer cells in your body. Then you don't need to be tested every year. You can
No.
go on your way for 5 years. You know you can't. There's nothing to see on a mammogram anymore
Yeah.
because there's nothing. It'll take at least 10 years for something that could possibly pop up after you had a clean test. So in other words, it gives women much more reassurance that they're clean too.
Yeah, yeah, yeah.
Yeah.
And it's cheaper by at the end because when you think about the t typical conventional uh, like protocols, they might want you to do when I was in my 30s or my 20s, I had to have yearly mammograms because my breasts were dense.
Could you
And
imagine what yearly mammograms will do to your breasts with dense breasts, exposing to the radiation?
oh, it
This
was
is this
awful.
is malpractice.
Yeah,
When
it
you say
is.
like people can't afford, what medical their insurance pay for, medical care is mostly worthless because people don't need they need to avoid medical care. They need to
Hmm.
stay out of doctors' offices, stay out of hospitals, and use nutritional excellence and good healthy sleep and all these other things we can do for people to help them get in great health to be in great health and to avoid the need for doctors. I always say, whether it's a naturopath or an osteopath or a medical doctor or a chiropractor, or a herbalist, stay away from all of them. Don't
Yeah.
go to doctors. Keep yourself well, so you don't need doctors. They're just gonna, it's like I say, I don't even go to myself.
You don't even look in the mirror. So,
Exactly.
so what I'm saying about this option, it's don't allow the insurance, and I say this all the time, don't allow insurance to dictate what kind of testing you're going to do. Because in the long run, I mean, if you think about it, if the protocol is or the process is that you go every other year or every year because they're concerned about, something in your breast or whatever, the radiation that you get, all that, and the cost. There is a cost to every time you go. Even though the insurance paying for it, there's out-of-pocket expenses too, and you're exposing yourself to radiation in your body. So I love this idea. I wish there were more in the United States that were out there, but
Well,
how
there will be, obviously. When something like this comes along, of course, we're an early adopter. There are other people who have centers that do similar things. And of course, we know in the next, as the years progress, there are going to be hundreds of these places open up across the country.
right, from your mouth to God's ears. I think that's wonderful. What a great technology. What a great message. And I just want to take a little break before we move on to the
Yeah.
next technology, unless you have more to say about this one. But I
No.
do want to talk about the fact that we have the I Am the Solution Natural Health Summit, and Dr. Fuhrman will be zoomed in. And I hope that he talks about these things as well, because people that have autoimmune conditions and cancer are being they're to me, and I hate to say this, it's like sheep to the slaughter. We trust the white coat. We've been taught to trust the white coat, and then when you hear the word cancer or some form of a disease, you go into this white coat trance and you hear and obey, and you just do whatever they tell you to do without your own research. And I always say, be your own MD, be your own medical detective. And I love the fact that Dr. Furman is bringing this information for all of us so that when you know better, you do better. And don't be lulled into thinking that because this is the only thing that they're presenting to you, that is the only thing that exists. So always, 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 when you do a search on anything that you're going to do, you're searching for whatever condition you have, but then always go back and look at how can you work on this naturally. Everything that I hear as a coach or whatever, I always look at naturally as a first line of defense. And this to me is even better than first line, second line, or third line. So I'm excited about what Dr. Furman is saying today. So I want you to go to whenyouneedafriend.com and go and while you're there, please become a subscriber of the website, and also go and to my social media and like and follow me there. Go to my sponsors page, support my sponsors the way that they're supporting the classroom. We rely on your donations. We rely on the help and the kindness of all of you who are getting this information for free. So please help support the people that are coming into the classroom as they're supporting the classroom as well. You can go to my Shop Now bag. We have lots of different products. I would love to have some of these places that are we can send you to, which I love. Dr. Fuhrman's retreat center. It's just amazing. I've been there myself, and I know that when you go there, you're going to learn. You're going to be educated. And so check out my Shop Now bag. These are from beauty products all the way to pain management, and see if this is something that works for you. There's also, you can become an enrolled student in the classroom, whether it's $1 or $1,000 a month, a one-time donation, whatever the case might be. Sharing this video with everybody you know, just to know that this technology is out there, and we're going to be talking some more about other technology as well. This might be the answer to your fear about what's conventional out there, and that you know that it is going to be radiating your body. So continue to listen today because Dr. Fuhrman has even more information. So please help donate to the classroom, and everything that you can donate, we appreciate. So today we have Dr. Fuhrman. You can find him at drfuhrman.com. I love every time that he comes on, and everybody that I coach becomes a follower of Dr. Fuhrman, because as a Nutritarian myself, I always feel that it is the best, most balanced way to live and to eat. So thank you so much, Dr. Fuhrman, for changing not only my life, but the life of others that do listen to you.
Pleasure. Thank you.
Okay, so we talked about the QT imaging. Is there anything else that you want to share about that before we move on?
No, we can move on to osteoporosis.
Okay, let's do it.
Yeah. Okay. Well, we've talked about overdiagnosis breast cancer. Now we have women being overdiagnosed with osteoporosis as well, using a radiation DEXA scan, which gives you radiation too. But the problem with the radiation on the DEXA scan isn't it's not that much radiation compared to a mammogram. It's not so harmful to get it once every few years. But the problem is you can't repeat it to see how you're doing. So if it's no radiation, and also it's not accurate enough, because many women are walking around with diagnoses of osteoporosis and osteopenia, and the DEXA scan really wasn't accurate to measure the density and fragility of both cortical bone and trabecular bone. The cortical bone is on the outside, the trabecular bone is on the inside. And because this DEXA scan measures mostly the external or cortical bone, your bone may be much more solid on the inside. And we could show that women need not to worry. Their bone fragility score is very low. And here, the problem with the conventional methodology here is also then putting women on drugs for weak bones and weak muscles, because the drugs then cause heart disease. So it's the drugs they use for women with osteoporosis. So they're overdiagnosing women and getting a lot of women are being walking around with these dangerous diagnoses. They think they're going to break, fracture, and they're put on drugs, and the drugs can cause a heart attack or atrial fibrillation. There was a recent study that came out, I think 1 month ago, showed some of the drugs used for osteoporosis, conventionally, routinely, right? Routinely used for osteoporosis, double the risk of heart attack. Can you imagine that? Double the risk of heart attack. It's crazy. And
Unbelievable.
and once the drug causes atrial fibrillation, now you have a heart condition for the rest of your life, and you stop the drug, and the heart condition doesn't get better. It can permanently cause damage to your heart. And of course, we were talked earlier about causing a fracture of the femur or necrosis of the jaw.
Yeah.
These drugs are just too dangerous to be on the market.
Well,
Um,
and we know that there are side effects to it, but we've been desensitized to these side effects until we get them. And so
yes.
then all of a sudden there's no reversal. There's nothing you can do about it because now it's a chemical reason that you got that next disease from the previous one. So
Right. You
what
were
do you,
warned about the effects. They gave you this big handout you could read with all the potential risks that people ignore that it's not going to happen to them,
nope,
but it does happen to them. And the
it
chances of
does.
happening to you with those drugs are too high. They shouldn't be allowed. But in any case, and then we have, the treatments we give people with exercise, power play, vibration, all nutrition, all the things we do to build strength
Mhm.
is much better than drugs if we didn't have another way. But now we have new technology that further accelerates reversal of osteoporosis or healing of fractures or resolution of osteoarthritic joints. It's called the lymph machine. and it
Okay.
changes. So now if we have a person that comes into our clinic and their echo light test shows that they have osteoporosis, we can put them on a lymph machine, which reverses it with no drugs, just by changing the ion channels. What we do is we vibrate them for about 5 minutes on the power plate, and then we give them the lymph treatments, which is the technology that you're putting this like a sound machine over them. You on the areas which part of the joints need to be treated. Put the hand, and we watched it how it heals gangrene, it closes up wounds, it accelerates healing of joints. And they're using this machine extensively in Europe right now. All the major soccer teams and athletes in Europe, all the major professional sports teams have this equipment to speed healing of injury, but it hasn't really penetrated the United States that well. But they're using it now where we can give women a series of treatments over a couple of weeks, and then we can watch them rebuild their bone. In the next 3 to 4 months, the bone builds back again, and
Wow.
their T scores are now coming back up and looking, dramatically more favorable in a relatively short period of time. They didn't have to wait 2 years to rebuild their bone. They didn't have to take dangerous drugs.
Amazing.
Yeah, so
Amazing.
the new technology does enable us to get
So
to.
the lymph machine, what I'm hearing you say that it's you use the plate vibrator, the plate the plates that vibrate, and then what is the treatment? Is it uh, the movement of the is it a manual massage for the lymphatic system to be
No, no, no. It's an expensive piece of equipment that goes on the back,
I
goes
had
on
no
the
doubt about that.
hip. It's imported from Italy. They're using it in Europe, and also we use it to heal fractures or to heal an athletic injury, like a
Yeah.
ruptured Achilles tendon or something. It rechanges so it's a machine. So you put the machine on the body, right touching on top of the body, with a bladder, and with the electromagnetic sound, electromagnetic waves,
Okay,
it
so
can change the ion channels and stimulate healing of the joints and
very
stimulate
good.
building of the bone. So
Okay.
it rebuilds back bone and heals bone that's been injured or broken.
Amazing. Amazing.
And it even heals soft tissue. And if we sometimes a person has a frozen shoulder or a spinal stenosis, we combine the soft wave therapy, the soft wave TRT, with the lympha so the person never needs surgery. Let's say you have neurologic problems with your back that you cause chronic back pain, pain shooting down your legs, spinal stenosis pressing on nerves. You need extensive back surgery? No, now we can see the soft wave TRT machine. You know what lithotripsy is, which breaks the shock waves that break up kidney stones.
Yeah.
They don't open the person up. They put on the external part of the body, but the water and electrical water shocks shatter the kidney stones to break up into a powder.
Yes.
What they found out is it doesn't hurt normal tissue. It doesn't hurt bone. It doesn't hurt the kidney. It doesn't hurt muscle. It only breaks up the abnormal kidney stones. It's the same technology we put on the joint that will break up calcification and scar tissue. It won't hurt
Amazing.
any normal tissue. And then the lymph machine combined with that will help now heal the ion channels and restore the bone back to the cartilage back to normal and strengthen the tissues around where we broke it down.
Amazing. So,
Yeah.
what's the name of the lymph machine? Because I know about a lot of lymph machines that are out there.
No,
Is there a
you're thinking lymphatic channels. It has
okay.
nothing to do with lymphatic
Okay,
channels,
that
the
good.
lymph
I'm
flow.
glad. Okay,
It's
good.
just called the lymph machine. That's just the
The
name of the machine.
lympha, the
Lymph
lympha. Okay.
machine. It
Okay.
doesn't do anything with the flow of lymph in the body. It's putting it on the joint that's bothering you, and it's
I
treating
love
that
it. I
joint.
love how
Yeah.
they repurpose that machine to that it has that same kind of
No,
function.
the soft wave TRT is a type of shock wave that repurposes the lithotripsy to use for joints. We use
Yes.
that too. And then the
Yes.
lymph machine is a different technology that we combine with that. So we put the person on the power plate for vibration just for 5 minutes,
Uh-huh.
and then we can treat them with the lymph machine to build back to build back the bone for
Got
osteo.
it. Okay. I thought you kept
But
saying
if the
lymph
person
machine.
has a ripped and torn shoulder,
Yeah.
osteoarthritic, they can't move their back, their hip is bad, they need hip replacement, then we can treat those people without surgery because then we can use the
Of
shockwave
course.
machine, which then sends cells and breaks down scar tissue and calcifications, and the lymph machine that helps rebuild the tissues by changing. We
Wow.
can use those machines to free up a shoulder from osteoarthritis or a hip or a knee. Obviously, when it's bone against bone, and there's no architectural cartilage holding the cartilage structure together, it might be too late for us to restore a person not to need surgery or not or to get them back to normal. But that's that's not we're not waiting so so late that
No.
all the bone is shot and the cartilage is gone. But
Yeah.
here we don't need we can put most of the work of orthopedists now doing surgery with arthroscopic surgery, meniscal tear of the knees, backs, micro disc and microsurgery of the back, and all these things that people are doing to their neck, with all surgeries to their neck, all these things now we can solve in our clinic, you know.
You know that they've done surgeries in the past of these orthoscopic surgeries, or they do it on patients that don't even know that they're not getting the surgery. They did a
Yeah,
test where they had people get it and people that didn't get it, but they thought they were getting it. And the people that didn't get it, that thought they were getting it, did much better than the people that got it, the surgery. So I love the fact that you're doing something less invasive that is truly going to help them heal
right.
naturally because you're
It's true
moving things around.
with arthroscopic surgery of the common meniscal injuries in our knee. All of our meniscal, age, and we get pain in our knees as we age. That has been shown that doing exercise and just letting it heal does just as good as surgery. But now we're taking things to a new level. We can actually get things better, to get better and much better than surgery even could do. Surgery is like almost the same as just waiting a year on doing nothing. But this is something really that can bring people back to feeling better and getting back out there on the tennis court or whatever they want to do with their lives.
Amazing, amazing. Okay, because I want to get to everything. So what else do you have in your bag of goodies?
Well, I think that's enough to talk about for this particular show.
Oh,
We
what
can do
about the
another.
immortal? What about the immortal chamber? Are we not going to talk about
Oh,
that one?
sure. Yeah,
Oh,
we can talk about the
no,
immortal
we have
chamber.
plenty of time. We've had plenty of
Okay.
time.
Okay. Well, so our office is called Longevity RX. That's here in San Diego.
Okay.
So people can call my 800 number on the website if they want to fly in or come, or if they live know a relative or live down in California, they can come to us to check them out. We can evaluate them. We can give them nutritional advice, and we could treat and we can help them in those ways. But the Immortal Chamber is for people who are living more locally or here regularly because they could come and they could come to the Immortal Chamber once or twice a week if they want and and just because it's a longevity tool besides the nutrition, the supplements, and all the things we do to reverse longevity. By the way, we're calling it Longevity RX because we can document with the blood tests that the person is getting younger as they follow these treatments. The
Good.
blood test that we use is called True Age. We use the True Age blood
Okay.
test and the True Health blood test. So we can get a measurement of epigenetic changes, methylation defects, telomeres, and we can see like maybe you're 50 years old, but the blood test shows you're 60. And after following our advice, the diet change, the immortal chamber, we could see we got you down to being a 60-year-old at the age of 60, and then a 50-year-old at the age of 60. We can show that we can reduce your aging with these by evaluate what we're doing. And the immortal chamber, the person is going in the chamber, lying on a comfortable bed, listening to soothing music while they're inhaling hydrogen, getting red light therapy, getting sound therapy, getting PEMF magnetic therapy, and getting vibrational therapy all at the same time. While they're spending 25 minutes in the chamber, they can come in to see us twice a week, or once or twice a week and spend some time in the chamber. And it makes your skin look better, your wrinkles go away, you grow younger. We give them the nutrition as well. So we really can actually make this claim that we can get people younger. People will laugh and say, that's so ridiculous. Dr. Fuhrman making the stupidest claim, making these false claims to get people
No.
younger. But let me just say this. I've measured it. I've been measuring this. I've been doing the tests on people who start changing the diet. They follow the program at the retreat. They lose weight, they eat healthy, and we repeat the tests. And the tests come back with the biological marking of aging, and we show that we got the person younger. I mean, we proved it with the blood test. I'm not making this up.
This is great because you're doing your own clinical trials. You're doing your testing and all of this, and you can report, even though somebody might say it's anecdotal, but sometimes I would rather hear an anecdotal story than look at a clinical trial that's been sponsored by the pharmaceutical industry or
Right.
someone that's trying
Oh,
to.
by the way, I just published a clinical trial on it. It was my most recent study. We had four other researchers on the project. We took 50 women on a Nutritarian diet, and we did the True Age test. They gave us a better price in the test because we bought them 100 tests in bulk, and the people from the True Age company were part of the research team on the
Wow.
study. So we did this study and we checked, we compared it to the same weighted standard American diet eating women to the Nutritarian women, and we found a much lower biological ages. And that study's been published in a very reputable major medical journal, just published last
Awesome.
year. Yeah.
Awesome. 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 Okay. So when it comes to this, the concept that you're building with your daughters, by the way, congratulations on your daughter's getting her naturopathic doctorate. And I smile when you were talking about the bed, the immortal bed chamber. I smile because you've come a long way, baby. Because as a nutritional, as when I first met you and I was becoming more into the frequency healing and all of that, it was like it's so nice to hear you talk like that because that's been my world for a while now, for at least 12
Yeah.
years. And I mean, I've been able to stay away from surgery. I've been able to heal, like plantar fasciitis, and I could be without having to do surgery or injections or anything like that. And I love the how excited you are about this. So how has your daughter's naturopathic journey impacted you?
Well, like it's kind of I'm enthused to be doing this new project with
Yeah,
her,
yeah.
and it's really fun, because now I have both I have three daughters, but I have Jenna is my partner in my Eat to Live podcasts, and she works in the business, and she's for years, and
Hmm.
it's so much fun having working your daughter, and
Yeah.
she's marketing, she's working with me all the time, and now I have Kara joining the business as well, and she's the doctor helping me do it, and she's going to be seeing patients and treating people, and she's got all this. She's added, we've basically what we've done is we've sought out every natural, because she's specializing as a naturopathic oncologist. That's what Karen's
Great.
specialty
I
is.
love it. I love
Yeah.
it.
So, and that doesn't mean she doesn't help women with pain and with us, but she's going to treat all these pain problems too, and all these people with body aches and pains and osteoporosis, and mostly, but and men with prostate cancer, but she's mostly a naturopathic oncologist dealing a lot with breast cancer. That's what she's doing a lot of.
Well,
And
having you as a mentor as well, her entire life, I'm sure she had a fast track to that because I
right.
know that that's been your specialty all along. When I first met you, you were focused on women's health and breast cancer,
Right.
and so good for you. I'm sure that this has
So,
been a moment of pride for you.
yes, it's been great. And what we've done, me and Kara have done, is we've looked at all the natural treatments, naturopathic, off medication, herbal drug, what treatments are actually effective for cancer besides conventional treatments?
Mhm.
Is it mistletoe? Is it apricot pits?
Mhm.
Is it, IV vitamin C? Is it, what? So we looked at all these things that integrative oncologists are giving, and we analyzed them and scored them on the research quality and potential for any benefits. And we narrowed it down to eight of the best, and we eliminated like 20 of the worst.
Okay.
So we made it so, and then of the eight of the best, are they good for every cancer or certain cancers? So how can we make it simple for a person with cancer can pick the eight best additional, So we've made it so we spent the last year or so just making protocols, so people can get clear advice and not be dragged down a rabbit hole of expensive, needless therapies,
Mhm.
insulin potentiation, or you're getting heat treatments and then chemo or low dose chemo with this and mistletoe treatment. There's so much treatments that are just money, suck your money out away and do nothing for you. And we really spent the time, my daughter and myself, analyzing which one of these things is worth it, gives you a benefit, and which ones really don't give you a benefit and are just needless cost.
Is that what you're
Yeah.
doing with Longevity RX with the new center that you guys, the clinic that you and your
Yes, we're
daughter
doing,
opened?
yeah, yes, we're doing that too, because there's a lot of these, new age cancer treatments that are run by medical doctors even that throw everything at you with the kitchen, in the kitchen sink,
Mhm.
charge you extraordinary amounts of money. We're talking
Mhm.
about $100,000, take your life savings away and do nothing for you. Zero.
Yeah.
It's all just based on hearsay. So we wanted to ascertain really where is the evidence, what is the worthwhile, which ones are worthwhile, and things like that. So yeah, we spent, so my Cara is really we put my head into that direction with her to try to figure this all out. You know what I mean?
No, that's wonderful. And I love the fact that you guys are, working together. She's the combination of the medical doctor and the naturopathic doctor is such a great combination. And the fact that you're presenting this as a wellness clinic, because a lot of people wait till they're sick to go to the doctor. And if you are promoting longevity and you're promoting health, this is really what true medicine is supposed to be. So good on you and good
Yeah, and
on Kara.
she's noticing the skyrocketing rate of breast cancer in younger people her own age.
Yeah.
In young people, and she says that, we've got to do something. This is crazy. We've
Well,
got
is
to,
the clinic open now, Dr. Furman?
no,
It's not open. When will it open?
it's not going to open until October 1st.
October 1st. Oh, well, we're going to have a grand opening
But
celebration
if
here in the
people
classroom.
book, they can receive 20% off if they book in advance.
Very good. Very good. Well, this is
Yeah.
wonderful
So,
news.
well, you know what? A lot of these places, you have to book them a few months in advance to get spots anyway. So we figure we might as well start telling people about it, even though it's still a couple months away from being open.
And you know what?
Yeah.
It'll be here before you know it. And so I am just really excited for this information. And wow, this is like, I've been like here all the time, when it comes to frequency medicine and healing modalities that are non-invasive. Um,
Right.
and, and and then you just took me off the roof here with all the new technology that you're presenting today in the classroom. So I'm looking forward to diving into it some more and maybe doing some classes with Kara, because it's really nice that she's taken the time to dive deeper into even what the naturopathic community is presenting as normal and viable. She's stepped it up a notch. So
Right,
thank
right.
you.
There's a lot of sloppiness there too of treatments that really aren't worth it being utilized. You know what I mean? There's a
Yeah.
lot of both, but half of what medical doctors do isn't proven, and half of what so we're trying to get to the best, most effective therapies,
Yeah,
obviously.
and it'd be nice to do a class where we can compare. This is even if it's a naturopathic or a integrative approach, what would be better than that? So it'd be
Yeah.
nice to do a compare and contrast on the latest of the latest in technology. So thank you so much for always being a trailblazer, and I'm looking forward to meeting Kara as well here in the classroom. And so thank you so much for being on the show. Please remember, Dr. Fuhrman is at drfuhrman.com. I'll have the information for his clinic and a link below, and you'll be able to contact them and let them know that Lily sent you over there too, because I love it when Dr. Fuhrman comes into the classroom, and I want him to always want to come back. And remember, November 1st, Dr. Fuhrman will be zoomed in from California, and he will be giving us lots of information at the I Am the Solution Natural Health Summit for cancer and autoimmune disease. Until then, please remember, I'll be right here waiting for you worldwide at whenyouneedafriend.com. This is Lily McDermott and Dr. Joe Fuhrman wishing you love, peace, joy, and unexpected abundance. Make it the best day ever. Thank you, Dr. Fuhrman. This was great. Great information.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before taking any steps to improve your life.